And in between during the lecture, if somebody wants to in, please anybody can just mute off the camera and just inform me. I will let me in. Okay, I'm busy with this presentation, so I may not be able to see that. Okay. So today we talk about something design and the architecture planning. It's a basic kind of thing. As a hospital consultant or as a MHS student, you should have some kind of idea. And as I told you initially, when you do some practical such kind of project, then that kind of experience, if you any chance you are able to get it, it's a wonderful kind of experience, and that experience is going to make you more matured in the hospital planning and the hospital consultation part. If you align whatever the things, whatever the concept I am telling in this hospital planning part, or going to tell you into this operation planning part, hospital planning part. So यहाँ पे we have to discuss three things. One is the functional zoning. Then we can talk about some floor plan optimization and the compliance with building codes. Okay. So functional zoning में we have to see, as we know, there are areas, mota mota we can decide into the clinical areas and the non-clinical areas. And in non-clinical areas, there are many other areas, admin areas, and various kind of other areas which are not directly the clinical area. Clinical area means where the patient they are coming directly, or some kind of wards are there, ICU may be there, and some ward where the IPD patients are there, or some kind of OT where the procedures are being conducted. Then we talk about this floor plan optimization. It is very important to make the patient flow easy, convenient, and same time the movement of the staff also. It should be maximum time. You see our staff in various places, and a lot of research has been conducted out. One of the major reason of burnout of the nursing staff or the paramedical staff, that is they have to travel lot of inside the hospital. So you have to make planning something like that, so that the movement of your staff can be reduced and minimized. And same thing about the logistic, as you cannot hold every item on each and every floor. So you have to do the store management according to that, so that at a very short time, logistics support can be provided in the needed area through separate kind of route. It should not be entangled with the patient route or something like that. So you have to plan in that way. Logistic movement is also, it should not be hampered. So when you plan something in the hospital as a consultant, you must see the convenience of the patient. Same time, you have to see the convenience of the staff also movement and the logistic. That is very important. Third part, under this design and the architecture planning, we have to see a lot of fire safeties. Okay, so at this point of time, we will talk something about the fire safety, disability access, and the some kind of seismic norms. यहाँ पे बिल्डिंग कोड आ जाते हैं बहुत सारे which are existing in the country. New hospital building code, it is the part of big policy and the which has been made by the government. That you can refer separately from that National Building Code kind of thing, NBC kind of thing. Okay. So first we talk about this functional planning, and the functional planning, why it is critical and the important in the hospital, because it ensures a smooth patient and staff flow. Infection control, that is one of the major concern in any hospital. Safety compliance, operational efficiency means different kind of movement of the equipment, staff, and the logistic support. And the fourth is a very important part, that is the future expandability. In case of you need your business supposed to they need some kind of expansion because of some reason, because of some to meet some requirement which was not all present previously. So if you want to that kind of expandability, or in some kind of disaster or some kind of mass casualty, then that planning should also be kept in the mind. Okay. Now, what are the basic principle you can think upon that? Mota mota as a hospital administration, you can think upon that कि जो CSSD है, That is the most sterilized area of the hospital. In terms of, I'm not talking about the OT because OT is the, if you take it, it is the most sterilized area. But this area which provides all sterilized item to the different part of the hospital. तो जो आपका CSSD है, it should not be in between the, it should not cross path between various kind of movement or some kind of waste disposal routes. उस टाइप के रूट पे नहीं होना है. That is few basic principles. It should be some in some isolated area जहाँ पे इस टाइप का कोई मूवमेंट नहीं होना चाहिए. Okay. Then we think about this vertical and the horizontal zoning. Normally हम देखते हैं हॉस्पिटल में everybody prefers ground floor पे ओपीडी बिल्डिंग हो. आईपीडी मे बी ऑन द फर्स्ट फ्लोर और सेकंड फ्लोर, मतलब दैट कैन बी द अपर साइड, everybody is not going there. And normally in the cities we see in the basement, if you talk about where the FAR ratio is very high, then we can think upon that basement parking वगैरह हमें बनानी पड़ती है to cater for the parking. That is also very important when we talk about the intramural and extramural transportation, how parking that can also significantly affect the functioning of the hospital. It seems small, but it affects. Then horizontally, we can think upon that emergency. It should be parallel to the OPD and it should also be on the ground floor. That is the ideal condition, and it should be some adjacent diagnostic wing also. May not be the main lab or may not be the main diagnostic center of the hospital, of the big hospital, but some extension of that diagnostic facility should be in adjacent with the emergency. As in the emergency, there are very critical cases are there, and at the point of care, when means at the bedside, you have to do a lot of investigation, lot of other. Suppose you have to do the bedside X-rays, bedside ultrasounds, and all that kind of thing. So you have to plan something like that. The accessibility of all these facilities in case of emergency, it should be nearby. Second, in the emergency part also, you have to think upon the triage part. Means यदि इमरजेंसी में बहुत सारे पेशेंट आ रहे हैं तो उनकी आपको ट्रायजिंग करनी होगी, एंड आफ्टर डूइंग द ट्रायज you have to start manage the patient. Triaging means in the detail that may be covered in the disaster planning. But triage means simple. Red part means patient is very critical, serious kind of thing. Yellow part is that the patient severity is not life threatening or something like that, but still he needs or she needs immediate attention. And the green part is that the minor bone and all that kind of things. And the black part is that which we are not supposed to hold that kind of patient in the emergency. That is a dead case. And death case may be of two types. One may be the brought in death, कि patient मरा हुआ ही आया, उनके उनके relatives and staff को नहीं पता है. And second, maybe कि while you are resuscitating the patient in the hospital, maybe collapse because of his critical illness or her critical illness. In that case, कि it is always better कि you have to shift the patient immediately from the emergency ward to the mortuary or something like something other area. And one very funny, you can say, when during some assessment of some hospital, he has done some extraordinary planning, and he has created a black kind of triaging area also in the इमरजेंसी. उसने उसके लिए भी दो दो बेड बना दिया. नॉर्मली क्या होता है, जब हम ट्राइजिंग की प्लानिंग करते हैं तो इमरजेंसी में ही हम अलग अलग कलर के बेड एरिया वो आइडेंटिफाई कर देते हैं. मीन्स रेड कलर के लिए देयर आर टू बेड, और येलो कलर के लिए टू बेड, एंड ग्रीन कलर के लिए वन बेड, समथिंग लाइक दैट. तो उस हॉस्पिटल ने एक ब्लैक कलर के लिए भी एक उसी इमरजेंसी में बना दिया. That sometimes these kind of erroneous or some unpractical planning you may also see in the field, which is actually not correct. When the patient brought in dead or patient collapsed while you are resuscitating in the hospital, immediately a devised person body or the dead body should be removed to a mortuary area or some defined area where it should not become in directly contact with the other patient. As a psychological impact of the diseases of the fellow patient, they also affect very much the recovery in the recovery of the patient. That is also a kind of research thing, how that can be affected, and how that can be minimized also. Then we think about this infection control hierarchy. We should always maintain some kind of hierarchy. Means high risk zone, OT and ICU, medium risk OPD, low risk मॉडुलर लो रिस्क एरिया आपके एडमिन हो गए, अदर पार्ट हो गए. मीन्स ये हायरार्की की जरूरत आपको कहाँ पड़ती है? When you are doing some kind of cleaning action, some kind of all that kind of thing. So you should start cleaning part of from the OT, ICU, and then you come to the less critical zones. Means ward, OPD, and the admin zone. Mein you can do it in the sometimes last part of that. So this kind of hierarchy you should also try to maintain in the hospital. And as I told you about this expansion also, your hospital or in all ward or something like that, it has to be some kind of future provision for some capacity expendability. So at the planning time, you can think upon that कि during the disaster or some kind of mass casualty, how much expansion you can do or you want to do that. That is up to you. Because when the disaster planning is being done comprehensive level at the state or at the district level, you have to declare such kind of things. कि how many beds in case of emergency you can expect. So that planning can be done, and that should be taken in consultation with all the relevant part of the team. As I initially I told you the members and all that. So based upon that you can discuss, and based upon the area also you can discuss. Okay, and but definitely extension plan is very important nowadays. And if you talk about this, our armed forces, there is very excellent planning for this disaster management. And whatever the disaster management we are learning or we are seeing in the civil, maximum thing, most of the thing they have been adopted from the part of the armed forces because they have a very efficient or very effective planning for this disaster management. So there is no harm if we can take something good from some other organization. We should take that. There's nothing like we cannot take or some kind of other ego issues and all that. Then this is basic kind of things as I initially told you. Ground floor pay we should plan. OPD, emergency diagnostic pharmacy, first pay. You can think upon that. OT complex. I should just give it to give you some idea. Second floor where we can think upon this general ward, medicine ward. Third floor where we can think upon this private ward. Even the admin office that can be at the third floor. And basement, of course, we do the parking and sometimes CSSD also because it's an isolated kind of area. The CSSD can also be planned there, and the maximum time laundry services they are also planned in the basement. If you have done such kind of a smart zoning, so as I told you, whatever the features are there, the purpose is that you can reduce the fatigue of the staff कि बहुत ज्यादा उनको चलना ना पड़े. You can minimize the risk, वो आपका होना चाहिए. And patient dissatisfaction can should be reduce, वो नहीं होना चाहिए. And if you do some kind of poor zoning, then it becomes a problem. Suppose आपके हॉस्पिटल में एक पेशेंट आया and for the OPD he has to go to the second floor. Believe me, patient is not going to satisfied at all. Whatever the kind of care, whatever the expertise, they are sitting at the third floor, the fourth floor, but patient will not like it like that. So that is why we have to such kind of zoning by keeping all that practical things in the mind and make such kind of plan. And if you do some smart zoning kind of things, you can enhance the delivery part. The care delivery can be high, even sometimes cost may be lower also, and the patient satisfaction is going to be increased, which ultimately helps in the better outcome. So that's why this zoning is very important. Then we can think upon this floor plan optimization. Purpose is main that अभी we are talking about zone कि infection zone हो गया, CSSD zone हो गया, all that kind of zone, OPD zone. Now we think about that कि movement part, यहाँ पे operational part आ जाता है कि where we think about that कि हमें travel distance को हम कैसे कम करें. ठीक फिर Second जो thing is important कि how we can reduce the staff workflow optimization. That is very very important कि हम अपने staff का burnout कैसे कम करें. In the first part where we see this thing also कि हम patient का staff को कैसे burnout से कम करें, but that mainly give the thrust on the safety part or on the infection control part. But when we do such kind of floor planning, we have to think upon the manual effort which are putting by the staff or by the patient. तो स्टाफ वर्क फ्लो ऑप्टिमाइजेशन इज वेरी इंपॉर्टेंट कि कैसे हम अपना स्टाफ के मूवमेंट को अननेसेसरी मूवमेंट को वी कैन रिड्यूस दैट. Based upon that, we create the different kind of wards and other things. Okay. And supply room को भी we should make it जैसे ICU है. In the hospital, maximum time we try to make say surgery near to the OT or something like that. So that movement of the sterilized item to the OT or the ICU, that can be movement time can be reduced, and same times movement path can also be reduced. Okay. Then we can create, if some big hospital is there, we can create a separate route or separate path for this staff only corridors, where only the through that part only the staff they can enter, and that will help in reducing the congestion in the public area. So that all depends upon the how much area you have. Then we talk about this infection control safety. That is also important part कि जब हम biomedical waste वगैरह जो भी हर एक एरिया में जनरेट होता है, we have to plan something like that कि that biomedical waste management it should not be moved into a common area. And इसका मूवमेंट ऐसा नहीं होना चाहिए कि biomedical waste management का आप वार्ड से लेके आप जा रहे हो एंड बीच रास्ते में आपका ओटी आईसीयू और सम अदर पार्टीज इन द इन बिटवीन. दैट इज अ रॉन्ग कंसेप्ट. तो वी हैव टू डू समथिंग लाइक दैट. एंड उसी तरीके से जो एयर फ्लो मैनेजमेंट है, मतलब नेगेटिव प्रेशर एंड द पॉजिटिव प्रेशर. नेगेटिव प्रेशर का कंसेप्ट क्या है? सिंपल फिजिक्स है कि कोई भी पेशेंट जो इन्फेक्शियस है उसके रूम को नॉर्मली वी मेक इट नेगेटिव. व्हाई? सो दैट जो अंदर इन्फेक्शियस एयर है दैट कुड नॉट बी मूव आउटसाइड. अदरवाइज क्या होगा कि इन्फेक्शन देर आर चांसेस टू स्प्रेड ऑफ द इन्फेक्शन द होल बिल्डिंग. तो वी हैव टू डू वेंट आउट फॉर दिस इन्फेक्टेड एयर इन द मैनर. कुछ हॉस्पिटल ऐसे करते हैं कि अपने इस निगेटिव प्रेशर रूम का जो वेंटिंग है वो कॉमन एरिया में कर देते हैं, वेर इट इज गोइंग टू बी मिक्स्ड विद ऑल द पेशेंट एंड ऑल दैट. तो यू हैव टू प्लान समथिंग लाइक दैट. उसी तरीके से जो ओटी में होता है वो पॉजिटिव प्रेशर होता है. पॉजिटिव प्रेशर का मतलब कि कोई बाहर की चीज अंदर नहीं घुस सकती है, अंदर की चीज बाहर आ सकती है, बाहर की चीज अंदर नहीं घुस सकती है. अच्छा, बाहर से कोई चीज अंदर जाए, अंदर से कोई चीज बाहर जाएगी, and as OT is the most sterilized area, so then the chances of infection and other things are not there. It is not there. That is why OT is there normally kept at the positive pressure in a normal scenario. But other infectious disease isolation जैसे कोविड का टाइम है, टीबी है किसी को, तो for such kind of patient, if you need some kind of isolation where the droplet infection chances are very high, you have to keep that patient into some kind of नेगेटिव. ओके. एंड ये प्रॉब्लम हमको कोविड में फेस हुई जब कोविड में हमें ओटी में किसी कोविड पेशेंट की सर्जरी करनी होती थी. देन इट बिकम्स ए चैलेंज कि हम उस पॉजिटिव प्रेशर को नेगेटिव कैसे बनाएं. तो उस समय चीजों को इम्प्रोवाइज किया गया. ओटी में बड़े बड़े एग्जॉस्ट फैन बड़ी स्पीड के लगाए गए, बड़े पावर के लगाए गए, सो दैट ओटी कैन ऑल्सो बी कन्वर्टेड इनटू द नेगेटिव प्रेशर. तो दीज आर ऑल द माइनर माइनर काइंड ऑफ इंजीनियरिंग efforts which are being put whenever the situation arises, something like that. So for this floor planning, there are things. One is the reduce the movement. Second, safety and the privacy of the patient. That is very important. Okay. Third, infection control. That is the third one thing. And the fourth, logistic support or the transportation of the store item should be very convenient. अभी जस्ट आई विल, हालांकि आई विल डिस्कस इन डिटेल व्हेन वी कम टू दिस वार्ड एंड ऑल दैट कि वार्ड की फंक्शनिंग या प्लानिंग कैसे होनी चाहिए. बट आई विल शो यू सम पिक्चर एंड यू जस्ट टेल कि व्हाट एवर द क्राइटेरिया आई हैव ऑलरेडी टोल्ड यू रिगार्डिंग दिस फंक्शनल प्लानिंग और दिस डिजाइन का प्लानिंग, इसमें क्या चीज आपको लगता है विच इज लेसर एंड विच इज द प्लस पॉइंट. ओके. This is the ward. You are able to see this picture?
Yes, sir.
Please. Okay, this is the ward, typically ward, and this is the old time ward, which is known as the Nightingale ward, a famous nursing person. You everybody knows, I think, heard this her name. That is the Florence Nightingale. So this is a Florence Nightingale kind of ward, जहाँ पे इस लाइन में भी बेड है, इस लाइन में बेड है, और बीच में होता है नर्सिंग स्टेशन. Okay. Now somebody can give the reply, whatever the point of consideration, whatever the point I have told you. आपको क्या लगता है कि इस पर्टिकुलर टाइप के वार्ड में नुकसान क्या है? What are the benefits and what are the negative points? ये आप बताओ.
Sir, good evening, sir.
हाँ, good evening, sir.
Sir, first of all, we'll talk about this kind of arrangement. Sir, this kind of arrangement can be made, sir, where there are non-infectious diseases patient which are there, sir. They can be kept in such kind of a ward, sir. Uh, the pros are, sir, you can always attend to a patient, sir. I mean, there will be you will require less number of staffs to basically and
Yes,
administer all the patients, sir. Firstly.
very good. Yes, supervision
Secondly,
is proper. Yes, very
yeah,
good.
sir. Supervision, the less amount of manpower will be required, sir. You can give
हाँ,
immediate attention to a patient in case somebody requires that kind of a thing. Thirdly, sir, the
हाँ,
isolation factor of the patient, sir. The patient will not feel isolated, sir. I mean, once they are in a barrack kind of a place, sir, so they will not feel isolated because of once a patient is ill or something, so a feeling of isolation can set inside the patient's mind, sir.
yes, that is
uh,
also very good.
you require less space, sir. I mean, in less space, you can have maximization of the resources, that is the availability of the space. Uh,
Okay.
one of the
That is actually a different part.
Sir.
When I will come to the detailed planning, I will tell you because there are some guidelines. कि
Okay,
between
sir.
two bed, it doesn't mean कि आप bed को साथ में कर दो. There are guidelines how much distance from bed to bed, how much distance from the foot end, how much distance from the head end. There
Correct,
are technical guidelines that I will discuss in the later part.
correct, sir.
But whatever you told, these are the plus points. What are the negative points?
So the negative points will arise in case of in case of a communicable disease, sir. In case some kind of a patient is there, sir, that can be one, sir.
Okay.
Uh, the second disadvantage of this particular kind of a setup is, I mean, the patient's comfortability, sir. I mean, there are certain patients, I mean, today's scenario, if you look at it, sir,
Privacy is not there. Privacy is hampered.
yeah,
ठीक है.
correct, sir. Privacy is not there, sir.
Hmm.
And uh, I mean, these are two very common things which is coming to my mind
Yeah.
as of now.
No, 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 very correct. You have to. If you just make a matrix kind of thing, no, whatever four things I have told, कि less traveling of the nursing staff, मतलब burnout kind of things. And second part is the some safety of the patient, or the immediate attention of the patient, and third, infection control part, and the fourth one, how the logistic movements are there. So if you see all these kind of thing in this perspective, then you will easily come to know. But whatever you have told is very correct, and I'm very happy at least you are not in the medical field, but still you are getting the more clear concept of such kind of word. Okay, now this is the another kind of word that is known as the private single bed ward. Okay, now anybody else who wants to tell except Colonel Legi sir? Anybody else who wants to tell something about this? Akansha, Kavita. Okay. Kavita, are you online? You are
Yes,
you
sir.
are at,
Yes, sir. I skipped your question. Sir, pardon, please.
मैं I have shown you this picture. But one photo के बारे में Kanan Negi has described excellently. And this is the second picture. This is the private ward, single private ward. If you can tell what are the benefits and what are the deficient point of this kind of arrangement if you are doing in the hospital?
Sir, if we are talking about the benefit, तो it's a private area जहाँ पे कि हम
Hmm.
जो है commonly एक patient को रख सकते हैं. उनको अपनी
हाँ,
प्राइवेसी
ओके,
एंड
ठीक,
कंफर्ट वगैरह का ध्यान रहता है।
ठीक,
और
सेकंड।
इसका बेनिफिट ये भी होता है कि जो है अगर कोई इन्फेक्शियस पेशेंट है या फिर जो
हुँ,
मतलब अल्टर्ड पेशेंट है वो भी रखे जा सकते हैं अगर केयर में है तो।
यस,
और डिसएडवांटेज
ओके,
की बात करें सर तो यहाँ पे 24/7 आपको केयर का मतलब नहीं मिल पाता क्योंकि एज कंपेयर हम लोग जनरल वार्ड में रहते हैं तो आसपास हमारे पास स्टेशन
यस,
होते हैं।
मतलब डायरेक्ट
यहाँ पे
सुपरविज़न नहीं है यहाँ पे,
जी सर डायरेक्ट
ओके,
सुपरविजन नहीं होते हैं।
okay. Now my question is from this point only, we have told very correct. How we can now I will talk something about the AI. Reason what I have done the course in the artificial intelligence also from Roorkee. So now if you can think about that in these private words, how artificial intelligence they can help to reduce all these lacks whatever you have told कि there is a मतलब कि negative point of this private part. So if you have and now this question is open to anybody and anybody Colonel Leggy, you can also reply for this question कि how artificial intelligence they can address the problem of this private part.
हेलो सर कविता या
हाँ हाँ बताओ बताओ प्लीज कविता यू कैन ऑल्सो टेल.
सर एआई से जो है रेगुलर मॉनिटरिंग पॉसिबल है। नर्सिंग स्टेशन पे मॉनिटर्स प्रेजेंट है पेशेंट से कनेक्ट अगर कर दिया जाए तो वो वाइटल्स और
Okay.
उनके जो है सारे अपडेट्स नर्सिंग तक डायरेक्टली पहुंचा सकते हैं जिससे 24/7 हम मॉनिटरिंग कर सकते हैं।
Okay, means you can think upon this Alexa and all that smart nurse assistant. Huh?
यस
Alexa,
सर।
you the patient can speak directly with the Alexa, and that Alexa message that is going to be the nursing station. That is a
यस सर।
smart nursing assistant. You can utilize all these kind of things. मतलब Alexa से they can Alexa that can integrate with the other facilities. Sometimes patient doesn't need light or sometimes they want to call the patient. They can just talk with the Alexa, and that can be created. Okay, so that is a smart nursing assistant. And what else you think? सेम टाइम्स जब ये सारी चीजें आर्टिफिशियल इंटेलिजेंस से होगी तो ओवर ए पीरियड यू कैन असेस द वर्कलोड ऑफ द नर्सिंग स्टाफ. कर सकते हो कि नहीं कर सकते हो कि हाउ मेनी टाइम्स he or she has to move to the patient, how many times he and she used to move to the different patient, different kind of patient. And over a period when such kind of data is there, you can easily plan staffing of your hospital or staffing of your area. Okay, in this falana area or this type patient, they need so much of time. So according to that, you can plan your staffing part also, isn't it? कर
यस
सकते
सर।
हो ना.
So
सेकेंड
correct.
पार्ट जो. हाँ हाँ बताओ बताओ प्लीज प्लीज.
So the aim of the artificial intelligence, like monitoring and basically carrying out a statistical review of a situation. So I mean, the future hospitals. I mean, AI will always enable us to have a more efficient kind of a system. So I mean, one of the forethought is that in the perspective planning, so the future hospitals based on the statistical data can be in a lesser space, in a lesser environment, sir, in the when the resources are
lesser
very very
manpower and all that. Hmm.
yeah, correct, sir. The future hospital can also be planned based on these statistical data over a period of time, sir.
Yes, yes. And in many countries they have that. China and
Sure,
all that countries they have already started
sir.
AI based hospital during the COVID itself. But now we
Correct,
can
sir.
think upon that जैसे कि if we talk about this NLP, you must have heard this NLP, that is the natural language processing. And in the medical, it is one of the biggest problem when you want as a medical as a hospital consultant or the administrator, if you want to start some kind of EHR system in your hospital, electronic health record, and the moment when the moment comes for the doctor to type the prescription and type the every complaint on the computer, it is the biggest challenge, believe me. Hospital with the most resistance you find from the doctor side. So this NLP is a very good option in the artificial intelligence where the whatever the doctor speaks that is going to be transcribed. Okay, and okay, initially it may not be very correct or something like that, but over a period, artificial intelligence something like that. after a certain period, it types or it transcribes the things exactly the same, whatever the doctor has conveyed to the patient also. And same time in the private room also, this kind of facility, if you are started, this NLP kind of thing, there is very less confusion between the doctors, nursing staff and all that. Because whatever the doctor is telling the patient, whatever the doctor giving the instruction to the nurse, they are easily through this NLP, they are transferred into the EHR kind of thing. And ultimately you can refer the EHR for any kind of confusion or something like that area. तो ये जो आपका सॉल्यूशन होगा, दिस कैन रिड्यूस द योर मैन पावर आल्सो. एंड you should not need to compromise the care में, there will be no compromise. In fact, care may be on the higher side, and staff requirement may be definitely reduced, and your accuracy may be enhanced. And what about the monitoring part? As everybody knows now, there are a lot of wearable AI sensors are there. तो इन द प्राइवेट वार्ड वी कैन यूटिलाइज दैट. मीन्स हार्ट रेट के लिए अलग से आपको सेंसर आ रहे हैं, रिस्ट बैंड्स आ रहे हैं, लॉट ऑफ थिंग्स आर देयर. कंप्यूटर विजन फैसिलिटीज आल्सो अवेलेबल देयर. दे कैन आल्सो टेल अबाउट द पेशेंट. पेशेंट मॉनिटरिंग में these all the equipments they are going to help in out. Okay. And उसी तरीके से this AI can also do some kind of help in the hygiene complex also, hygiene compliance also. And one practical thing, अभी आप देखो उत्तराखंड में one of the very sad incidents occurred 3-4 days back, and lot of casualty or something like has been done. But don't you think it can easily be actually it could be easily predicted? ऐसा नहीं है. We are so much technologically advanced. हम बोलते हैं और हैं भी, ऐसा नहीं है कि हम टेक्नोलॉजी एडवांस नहीं है. तो एटलीस्ट मेरे को ऐसा लगता है कि देयर मे बी सम काइंड ऑफ लैप्सेस फ्रॉम आवर साइड आल्सो, कि हम इस बिजली बादल फटने की घटना को प्रिडिक्ट नहीं कर पाए इस आर्टिफिशियल इंटेलिजेंस के जमाने में. अदरवाइज आई एम नॉट टॉकिंग अबाउट द बिल्डिंग एंड द प्रॉपर्टी एंड ऑल दैट, बट एटलीस्ट जो ह्यूमन रिसोर्स था, that could be evacuated in the time if we have utilized this artificial intelligence based data or something like that in a proper manner. So at least we could save some life. What is your opinion? What are the opinions of the other students who
Uh,
are in the this group?
Sir
Do you
Jain,
think?
sir, I would
uh,
like to share one small incident, sir. I mean,
uh,
sir, the technology definitely would play a part in this thing. But, sir, one small incident which I would like to narrate, not very far off,
uh,
sir.
uh,
I mean, sir, we all know that there have been incessant rainfall over a period of time, sir. And of course, one
uh,
such kind of warnings are issued. And in an army, sir, we are very, very we
uh,
are very, very, familiar with the warning system and everything, and we take necessary actions. But,
very
sir,
true.
in the normal stream of civilian life, which I have seen, sir, when schools
Mm.
are being closed even for 2 days, na, the parents are having that insecurity कि school वाले school बंद क्यों कर रहे हैं? Sir, one
uh,
has to understand that first of
uh,
all lies the security of a person, and thereafter the other
mm,
things come into play, sir. So,
mm,
though artificial intelligence could have predicted this kind of a response system, sir, but people are not ready to leave that kind of a particular place, sir. आई मीन
mm.
लोग स्कूल बंद होने पे सेंटी हो रहे हैं सर. आई मीन दैट वे कि स्कूल 2 दिन के लिए बंद क्यों हो रहा है? अरे ठीक है सर, बारिश हो रही है, अगर 2 दिन बंद भी हो गया तो क्या फर्क पड़ गया? द
नहीं,
माइंडसेट ऑल्सो ऑफ द पीपल हैव टू चेंज ओवर अ पीरियड ऑफ टाइम, सर.
नहीं, तो वही है माइंडसेट. कैसे आप हेल्थ में क्या होता है कि यू कैन चेंज द माइंडसेट. माइंडसेट ओनली विद द प्रॉपर इफेक्टिव कम्युनिकेशन. दैट इज व्हाई दिस
एब्सोल्युटली सर.
पब्लिक हेल्थ में जब हम पब्लिक हेल्थ की बात करते हैं, वी आर नाउ इन द मास्टर हॉस्पिटल एडमिनिस्ट्रेशन पार्ट. बट
सर
व्हेन यू टॉक अबाउट दिस पब्लिक हेल्थ,
सर
it is only the communication which can influence the public. Do you think कि इतने गांव देहात में जो लोग रह रहे थे, it was very easy to convince them to come to the hospital for the
एब्सोल्युटली
institutional delivery?
एब्सोल्युटली
It
सर.
was very tough.
वेरी टफ.
But it is only the communication. That is why in the public health there is a part of this behavioral communication changes and all that, जो आशा लोग और ये सारे लोग करते हैं. So that communication is very important. We cannot
करेक्ट.
blame the person कि उसने मेरी बात नहीं सुनी in such kind of scenario. If
करेक्ट
somebody
सर.
wants, believe me sir, कि if this operation was being looked after by the army, it may not be number of casualties. Definitely
करेक्ट
it
सर.
might be reduced.
एग्रीड सर.
Why?
एग्रीड 100%.
Because they know कि उनको क्या करना है. They are not going to take the opinion of this kind of thing. So
They
one
work on
flat.
sir, they work on a common operating picture, sir. I mean, which has to be adhered by the maximum, rather everyone, sir.
No, we have to do that, na? Because we
So,
don't have such kind of option. Because one in the one flood operation, I was there in the Darbhanga, and we have to evacuate the whole Darbhanga Air Force Station by a
so
chopper on the school building because every area was flooded. Na, कहीं chopper land ही नहीं कर सकता था. All the runway, everything become just like a river.
correct,
Even
sir.
in that situation, each and every person was evacuated from the Air Force station,
So,
except that operational team जिसमें मैं था और एक और कर्नल थे ऐसे करके दो तीन लोग थे and other
correct, sir.
staff also. So that
So,
can be done also, but at least मेरे को लगता है कि in sometimes we are not utilizing all these things in the it is a very basic thing ये बादल फटना and all that it could be easily predicted
yes, sir.
but
Very easily,
somehow
sir.
there may be some lapse. So
Yes.
that is why people could not be evacuated. Building and infrastructure का तो you can't save that. There is no question
Correct,
about.
sir.
You can mitigate, but कुछ ना कुछ तो डैमेज होगा. But at least जो लोगों की जान गई that can be reduced. This is my मतलब just personal opinion. That's nothing
Absolutely,
else.
sir. Absolutely, sir.
Okay, so they have, by these means we can see we can utilize this artificial intelligence in various way to for our benefits for better patient monitoring and all that kind of thing. Initially, but there are some challenges also in the artificial intelligence. Initially, it may have some kind of high initial cost and we need some staff training and all that, but it is all the initial part and over a period when all the things are streamlined, we would have a very great kind of system in our healthcare system also. So that may be the as we have told the correct thing. In future also we will do think about that. And this is one more ward which is very common kind of thing, which is called the race track ward. मतलब यहाँ से यहाँ तक ही आपको सारे बेड दिखेंगे और यहाँ पे एक नर्सिंग स्टेशन दिखेगा विच इज द नाउ डेज मोस्ट कॉमन ऑफ कॉमन टाइप ऑफ वार्ड इन द मैक्सिमम हॉस्पिटल. ओके, नाउ वी टॉक अबाउट दिस ऑप्टिमाइजेशन कि हमें वही दैट इज द सेम detail whatever the already we have discussed कि how we can do the optimization of the floor planning space and all that. So lot of things we can utilize and यहाँ पे I have just talked about this yeah, technology also. And if you take the example of this higher interdependency areas, OT, ICU, and blood bank, they are actually in some cases, most of the cases, if you have such kind of basic understanding, they are just interdependent area. ओके जैसे ओटी के पास यदि आईसीयू होगा क्योंकि ओटी से पेशेंट निकलने के बाद इनिशियली तुरंत वार्ड में नहीं जाता. दे मस्ट बी केप्ट इन सम एरिया एंड इफ द क्रिटिकल केस इज देयर मे बी शिफ्टेड इनटू द आईसीयू. And OT में same time we need a blood and all that kind of thing. So it is always better कि all these kind of facilities and even in इसमें एक CSSD भी आप include कर दो, they can be clustered all together. Then the movement may be very easy. इसी तरीके से if we talk about this maternal care and all that. Suppose एक floor पे हमारा maternal OT है, same floor पे we have some ward for the maternal ward kind of thing where the patient after the normal delivery or after the cesarean they can be kept on that. And then same floor pe we have some kind of an ICU also, neonatal intensive care unit. So that all things can be planned something like that. So that ऐसा ना हो कि मैटरनल का लेडी का डिलीवरी थर्ड फ्लोर पे हो रहा है, सेकंड फ्लोर पे हो रहा है एंड बच्चा जिसको प्रॉब्लम हुआ वो फिफ्थ फ्लोर पे चला गया एनआईसीयू में. तो प्लानिंग शुड नॉट बी समथिंग लाइक दैट. ठीक है. नॉन क्लिनिकल के लिए जो प्लानिंग होती है एडमिन स्टाफ लाउंज एंड ऑल दैट काइंड ऑफ थिंग दैट वेयर दैट यू कैन प्लान समथिंग लाइक दैट. उसको आप कर सकते हो. एंड जस्ट फॉर मोटा मोटा अंडरस्टैंडिंग क्लिनिकल एरिया 60 to 70% जो हमारा हॉस्पिटल का स्पेस होता है they are considered in this clinical area and approx 30-40% जो area है they consider in the non clinical area in a ideal situation or in a normal situation. Okay, otherwise it can also vary. This circulation planning, initially I told you, you have to do all this kind of, you need some kind of dedicated service elevators. मैं कई सारे बड़े हॉस्पिटल में होता है कि एक एलिवेटर से सिर्फ लॉजिस्टिक के सामान जाएंगे, एक से स्टाफ जाएगा और एक से पेशेंट जाएगा, बट दे आर ऑल प्लानिंग इन द बिग हॉस्पिटल. बट दैट कैन बी ऑल्सो थिंक अपॉन दैट. उसी तरीके से जो बायोमेडिकल वेस्ट जो हम डिस्पोज करते हैं उनका भी जो एग्जिट रूट है दैट शुड बी समथिंग different from the other areas so that infection could not be mixed with that. And technology driven what optimization we can do that As already we have discussed, even with the AI and the predictive analysis, we can forecast the peak OPD times in the hospital. And based on that, we can adjust the OPD room also. Okay. मान लो कि OPD आपका at 10 o'clock, your system has told 10 to 12. There are that is a peak time for the OPD. So during that period, you can make the doctor sit in some bigger room. But you find that after 1 o'clock or 2 o'clock, there are number of very less patient. Then you can make shift arrangement. You can shift the doctor from that big room to some small room, and that big room can be utilized for some other thing. So that is a very you can say advanced kind of planning you can do with the help of this AI and the predictive analysis. IoT, as everybody knows, this is the Internet of Things, means the items and the sensors which work based on the internet kind of things, and these are basically important for this tracking and all that kind of thing. And in the, if some patient they entered the hospital, okay, same time you can give some kind of bearables band and all that things, and the patient wear that. And then first you go to the registration counter, OPD counter, then diagnostic counter, then the pharmacy counter, and these all timing can be recorded into that particular gadgets. And after the analysis of data further, you can see where the most of the time is being consumed by the patient, and then you can look into that कि how that can time also be reduced. क्योंकि हॉस्पिटल में एक चीज और बड़ी चीज है कि नो पेशेंट दे वांट टू वेट फॉर समथिंग, दे वांट कि हम हॉस्पिटल पहुंचे, इमीडिएट हमारा काम हो और हम इमीडिएट निकल जाएं. तो नॉर्मल पेशेंट का साइको इट इज एवरीवेयर इट इज गोइंग टू बी सेम. Even in our clinic also, where we are doing this CGHS and the ECHS clinic, every patient they just want कि मेरा काम फटाफट हो जाए. They are least bothered कौन देख रहा है क्या देख रहा है, बट उनको लगता है मैं आया हूँ मेरा काम फटाफट खत्म हो जाए. उसके बाद लीन हेल्थ केयर डिजाइन होना चाहिए. रिडंडेंट स्टेप्स हम ना ऐसा ना बनाए कि हमें बहुत सारी एक्टिविटी अपनी बार बार करनी पड़े. रिडंडेंसी को हमें रिड्यूस करना है. तो दैट इज वेरी वेरी इंपॉर्टेंट पार्ट ऑफ दैट. Okay. So I think at this point today I should stop. It's almost 9:30, and in the next lecture we will talk about some seismic forces and all that kind of things. Okay. कि building code क्या होता है, fire safety में क्या है, what are the seismic code for the hospital, and different seismic code में what are the actions we are supposed to take, या what are the planning we can think upon that. So I will discuss these things into the next lecture. Maybe sometimes you feel that these are slightly more technical things, but believe me, basic knowledge of all these things is very important of a student who has done MHA. And unfortunately, most of the academic system, they just don't want to touch on all these aspects in some detail. But I will take some time. I will take some much more time on this hospital planning part. If you have some good basic understanding of this hospital planning, it is going to be help you in a lifelong. If you sometimes if you complemented with some kind of experience for the real hospital planning and all these things, it will just going imbibed in your mindset also, and you can easily understand when you think about the hospital or planning about the hospital what is important and what planning should be needed.